Swayam Prabha. Digital India. Educated India.
Welcome friends once again to our NPTEL MOOC module on health economics. I hope you have been following well to our this module, and specifically of this speak on supply side aspects. We have so far taken 4 lectures. This is in fact going to end this week with this lecture. And here we are actually emphasizing how profit and non-profit maximization works in healthcare. Hence the title is Profit and Non-Profit Maximization Models in Healthcare. We did, especially in the previous lecture, explaining the production and cost theories, which are indeed relevant for economic healthcare as an economic good. And in this lecture, we will be discussing on the supply side perspectives of firm industries in the market, especially emphasizing their different market structure, following their traditional theories and the non-traditional theories as well. And also we will discuss about the what is contestability and why should we adopt contestability based approach in our studies. Let us classify what is called market, and as you might have read microeconomics, and where buyers and sellers and their meeting place is decided, and they follow follow certain negotiations, and those used to be considered as order of exchange. In short, market is a place where those who wish to supply goods, they are the sellers, and those who demand as buyers are brought together in order to effect an exchange. So they follow a strong eventual contracts to settle their dealings. So who are the sellers in the market? Usually they are the hospitals, hospitals who provide healthcare to patients, medical equipment manufacturers or pharmaceutical companies provide inputs to healthcare production process, etc. And who are the buyers in this case? Of course, they are the households or the individual who buy healthcare services. Hospitals employ healthcare professionals from labor market and buy their inputs such as pharmaceuticals, etc. So then define firms in healthcare market. In this case, firm is an economic unit that produces and sells goods and services. And which are the goods? In this context, we are saying goods are the medical equipment, where the services are like dental care services, health insurance services, etc. And all these actually form together an industry. Hence, an industry is a collection of economic units that really sell similar products. And for example, we may say instead of individual drug to be sold, we say the pharmaceutical company or the industry or the insurance industry or the hospital industry as a whole. So we are actually linking this discussion to theory of firms, which mentions that supply side economics majorly concerns with theory of firms, where firms are highly motivated to maximize their profit. Most of the farm companies and many insurance companies indeed target to maximize profit. However, most hospitals, nursing homes, insurance companies do not aim this. Hence, the discussion, the problem statement we just focus here, that is not just the profit that to be maximized, it's rather beyond that. Okay, a study of profit maximization model is useful as it gives information on performance benchmarks and efficiency. So, we are discussing efficiency elsewhere, but the concepts etc. are sticking. You may raise your points for your research. However, the benchmark and standards are also required to be defining a company as part of the performance indicator. Statista, very well, I think. Statista is a platform, is a database, provides the macro information, especially at the aggregate farm level, even in company level information you will get. So, we are referring the figures from Statista of different companies. Here the figure is on net profits of leading pharmaceutical companies in India as of 2022, and the figures are in billion Indian rupees. Okay. So, and the companies are like Cipla and Glenmark, Dr. Reddy, Alchem, etc. I think many of these names you might have heard, and they are the dominating player. So, we have just kept whose market share, net profit are among the best out of the all pharmaceutical companies. You can see the two companies in the top capturing near about 30% of the market share. It is not exactly called market share, it is called net profit. Okay. So, somewhere it is reflecting how dominating these companies are, and then we will also discuss some of the directions to understand profit calculation, how to calculate profit. As we know, profit is nothing but revenue minus cost, or that is precisely called total revenue minus total cost. So, TR, as we all know, TR is nothing but the in per head price times the quantity is being sold minus per head average cost times the quantity produced. Okay. Then there are some concept we derive from it called once we divide it by Q, then we can make it their average one, and also Q in that case called average profit. Okay. And then this concept will be this one will be a total revenue TR divided by Q is nothing but AR. Okay. All right. So far as average profit is concerned, so profit I mean this is through average profit. Now, these concepts are very valid when you are actually analyzing the healthcare as a whole. Now, this is what is mentioned. So, the usual concept which is discussed in microeconomic theory or in healthcare perspective is on whether the company is actually attaining the minimum profit, or in general term we say the normal profit. That is precisely called no profit no loss condition. The meaning in simple term we have mentioned here, the owners of the especially in an example like fertility clinic must earn a minimum amount of profit to prevent them from closing down their business and doing something else instead. So, in along with this we also suggest you to also follow some of the analysis which managerial people, management guys used to do it, called break-even analysis. Okay. So, I am not explaining much on this, but usually it is connecting to the pi when it is equating to 0. Whether the company is deciding further to continue or not, usually the company takes a bold decisions in this case. Traditional economic theories of the firm based on profit maximization, and that is as per the traditional economic theories, and hence there are 4 important broader markets defined when we are sticking to product market, not the factor market. This is precisely referring to the product market when market is related to the product or the firm. Okay. or the product prices are being evaluated through different features of the market. As you know, perfect competitive market, monopoly, monopolistic competition and oligopoly, these are in scale. The monopoly and perfect competitive market are the extreme end of the scale. Perfect competition where and then monopoly, in between lies with monopolistic competitive market and oligopoly market. Okay. The simple meaning of monopoly, I think everyone knows, even if you haven't read, it might be from medical science background. For you, it is no need to go by the standard definitions. It's a simple meaning of it is that a single player or the group of player, when they have actually taken a common decisions, okay, made a strong tacit or formal agreement to decide a price, okay, and where they have actually camouflaged the market and taking a single decisions based on their own quotations, etc., are largely called monopoly power. Okay. Now, when I say monopoly power, it is quite obvious that the decisions are with the individual player, okay, irrespective of the quality of the product. Hence, quality of product might be compromised because hardly there is any checkpoint. Whereas in the other extreme point, where it is the bargaining power is largely restored with the buyers, wherein monopoly it is with the seller, isn't it? We will discuss everything in a scheme in our next slide. I am just giving you the rough directions to it. Hence, whenever market power is concerned, we usually say through markup pricing, etc., how the price is charged over and above the marginal price or marginal cost. So it is considered to be P minus MC by P. Okay. So called markup price. You will read that if markup price is usually exercised very well by the monopolist, and much less or near about zero markup pricing in perfectly competitive market. And how to calculate all sort of things, I think there are different research questions. We are not discussing much on this. It has a connection with concentration index. You can calculate through Horpindal-Hirschman index or market power calculations by their dominant sharing, okay, etc. Okay, like the recent example, instead of looking at oligopolistic structure, pricing decisions in the recent time, it's not just a product, the function of a product. I mean, the company might be deciding based on a feature of the competitor, like like Flipkart is actually deciding. Flipkart and the Amazon, you must have checked that the pricing structure are more or less same, but the offers are taken by someone first and another quickly follow. Okay. In that case, it's not the product that matters. It matters how far you are actually capturing your customers, how far you are bringing your customers. It's related to two-sided market. One market is actually a function of another market, not the product or the pricing. Okay. So it's very interesting, it's not just the target as profit. Yes, eventually because of the elastic structure, with little differences in offer, you will capture the profit through the selling. Hence, the target is sell maximization rather than just profit maximization. There are some companies like Rolex, etc. You see Rolex or very premium segment like your Apple products, Apple computer, laptop, etc. They have a premium pricing structure. So price skimming is usually the direction for it. Given all the directions, I mean not relevant much in healthcare context, but hence premium hospitals, facilities, like there are couple of hospital units in Delhi, even as against the complete public based model called Mohalla Clinic in Delhi. So there are different structures. The premium structures are still preferred by customers because of certain premium qualities they follow. Hence, by discussing this general context, I am coming to relate to these markets to our other target, non-profit target maximization. approaches called growth maximization theory, behavioral theory, utility maximization theory, or hospital age physicians cooperative theory. We are going to explain all those things one by one, how relevant in the present context. But before that, we will clarify what are those 4 types of market structures. Okay, market like perfect competitive market, monopoly, monopoly, oligopoly, etc. So here are the features for you. What you find is the following. We usually refer through the important 4 or 5 or 4 indicators. For the perfect competitive market, you just see it's related to number of firms in the market, entry deterrence, etc., type of product, price controls, etc. Out of these, first on perfectly competitive market, you see there are in fact very large number of firms exist in this market, and hence nobody has the control over the market, and hence they are not the price decision maker, and they are bound to accept based on the eventuality directionals within the eventual directional within the market. Whatever a combination settles, that has to be considered as the best win-win solution. And if you go by the typical microeconomic theory for the perfect competitive market, there are a number of derivations, proofs given how it is actually they are the price takers, and that is indeed maximizing their strategy. So, we are not discussing much on it, just try to clarify what is there. Related to entry into a market, there is no restriction indeed, on therefore it is said as unrestricted. Type of product considered to be homogeneous, so and the exact word is undifferentiated, all are considered to be equal. But equality is very difficult, the right term is homogeneous. Okay, and price control, no one has price control. One of the famous example in this case we have tried to give it, called internet, internet pharmacies. So, where these features largely followed. And in the second case, monopolistic competitive market, but still some clarification we wanted to add for perfectly competitive market, which I just mentioned. In addition to that, perfect knowledge and firm is a price taker, free entry and exit, product homogeneity we have already discussed. And you have to now, if you do not want to follow the diagrams, it is still perfectly fine, but we suggest you to go through. But its first part is for the industry, second chart is diagram is for the firm, how firm are the price taker. Okay, so I am not discussing much, I will just give you one clarification. In other market and their demand structure, you can also do it on your own. As an industry or in a market equilibrium, if you simply remember, our demand curve is downward sloping and supply is upward sloping, and based on that the price is decided at the market level. Once the price is by any reason decided, okay, with all possible contracts, a eventual outcome, that is price is determined, and that has to be accepted, by all the firms. Okay, they are the individual firms, and this is the industry. Okay, and this is the firm behavior. So, what we say, since they are infinite or large number of firms are there, so they cannot have in any major share, so they have to accept this as their price. So, every time they are going to sell the pharmaceutical product at the same price. Okay. Hence, the average revenue is actually constant. When the average revenue is constant, then this is also equal to the marginal revenue. Okay. So, and this is nothing but the price. Whereas, to decide how much to be sold, it is the responsibility of the firm to what extent they manage their skills with their management skill to actually control their through maybe allocative efficiency or their managerial efficiency, whichever the way they can actually able to restrict their cost of production. The cost of production might be higher, might be lower. Let us, and for an example, this is at this moment we have discussed about short run average cost, and this is short run marginal cost. A stands for short run, and in the short run I am just explaining that the average cost curve follows a U-shaped curve, and the marginal there in principle, if you take the derivative of the slope of the one and equate it to 0 at the minimum most point, marginal cost curve will actually pass through the minimum most point. And as per the profit maximization, we are supposed to maximize TR minus TC. We have to take faster derivative d by dq equal to 0, then d square pi by dq square. Okay, that should be, since we are reaching at a maximum point, then second has to be less than 0. Okay, so in that case, so if you solve it, in principle our faster condition must be satisfied. Faster condition states that MR should be equal to MC. Okay, hence this point is actually satisfied. And the second sufficient condition is that MC, the slope of the MC curve must be higher than that of the slope of the MR curve at the time of equilibrium, or at the place of equilibrium. So the slope MC is actually rising, where the MR curve is actually 0 slope, hence this is also fulfilling the second order condition. Hence the equilibrium defines the maximum quantity an individual firm can able to sell, and corresponding to this level we can plot our average cost, and average cost times the price is nothing but the profit an individual firm can earn, given the fact that their average cost curve is still below the prevailing price rate or the marginal revenue. This is what we said for a short run perfect competitive structure. In the long run, situation is little different, and in the long run, especially in perfectly competitive market, probably we are not explaining. Yes, we are explaining here as well. In the long run, yes, in the short run, we get pi is positive. Pi is possibility. Pi could be positive, could be also 0. Okay, could be also 0, could be also negative. Okay, there are all possibilities. Okay. So in the short run, because of the fact that the company might not have adjusted very quickly in the short run. However, once it is negative, there are some concerns. We have to find out whether the company can able to cover up its minimum cost. That is considered to be average variable cost. If average variable cost is really covered, then the company will operate in the long run. Okay. And in that case, we used to define our condition called shutdown condition. Shutdown condition, that has to be equated with the average variable costs. So, I am not explaining much in this case. I am sure if you raise doubts, we will be taking extra lecture without any hesitation, and we will clarify. However, in the long run, what really happens in there are large number of firms, so and there is no entry and exit barriers. Hence, the incremental profit whoever the marginal firms derive in the industry, there will be further adjustment. This might be the first price, and when in this case it seems that companies are actually earning profit, and because this distance you can easily see, you can see that there are profit earned since average cost curve lies below. And there will be eventual adjustment, because other outsider firm will try to penetrate to the market, and they will actually erase or consume all possible profit, and hence total supply will rise, and supply curve might shift actually rightward, and that will actually pull down their profit and price will actually fall. Finally, the final settlement might occur in a point where all the possible supernormal profit are actually vanished, and firm at this particular point is in a position not to actually go out, not to enter further. Hence, this is considered to be the best equilibrium point in the long run. Hence, the final eventual outcome in the long run is normal profit. Okay, where pi is equal to 0. So, this is what and this is what happens in long run equilibrium in e-pharmacy sector as well. And at P1 we already said firm might earn supernormal profit, but at PL no profit is earned and normal profit is earned to be sustained in the long run. Long run equilibrium condition hence is given. This is all this P short-run average cost, short-run marginal cost, long-run average cost, long-run marginal cost should equal to P. Okay, and ARMC or ARMR all are should be equalized. Now, to some extent, it is good to also discuss the monopoly, market and their features. We explained perfect competitive markets in a short while. Now, we are discussing monopoly, single seller, then restricted entry. I mean, complete entry and exit are actually controlled by the person, hence restricted and completely blocked. And type of product is unique, whatever the single seller is selling, and the price control is considerable because it is with the single seller. Some example like government monopoly, you can refer like medicines in the short run and public health insurance, etc. Can be also referred. So, similarly in monopoly, the picture is little different, since that was in individual firms context were discussed, but here monopoly firm is nothing but the monopoly industry, and the demand curve is downward sloping, and rest of the demand curve is downward sloping, and rest of the directions are discussed. MR equal to MC, MR has to pass half the distance, this distance should be equal to this distance wherever it intersects. Okay, anyway, I am not emphasizing this, we are just clarifying this is the price, how it is determined. Okay, and once based on that we can plot the possible profit from the AC curve, and then profit is expected to be positive. And so it depends upon, and then that too, one of the important feature of this market is that is elasticity of the demand, which monopoly space is inelastic. Okay, it's less elastic and downward sloping because of the fact that substitutions are very less, hence the changes in the demand pattern responsiveness with the demanders is very less. Okay, so and monopoly regarding price discrimination, monopolies can also exploit their market power by selling their product at different prices, and hence I am not discussing, you please go through. One example we have cited for the tuberculosis drug, especially its name is bedaquiline as part of the the important medicine of for TB, tuberculosis patients, produced by Johnson and Johnson. This is a major pharmaceutical company in the US, and they got the approval from the FDA in 2012. This was a big deal because it was the first new TB medicine in over 40 years. And so this Johnson and Johnson had the right to make this particular medicine, that is bedaquiline, until July 23 they had the right to produce. So since this period is over now, and earlier this year this medicine tried to extend the patent years for another roughly around 5 years, but the Indian patent office said clear no, and after that this company lowered the price of the drugs by 55%, going from $289 to $194 for a 6 months treatment course. Now you can see, once the patent, that means once somebody is carrying a patent is actually carrying a monopoly power, and once it is over then they are becoming more competitive, hence the price is less. Another market is called monopolistic competitive market. The features are here, but one of the interesting feature of this, that there are differentiated products, and products are highly closely substituted. Okay, so that is one of the interesting market, and example is that hence they have some control over their product, and medicines in the medium and long run are referred to be monopolistically competitive products, and you can also differentiate this with the perfectly competitive market, and here the demand structure is fairly elastic. Okay, and hence because of the fact that they have a high degree of substitutions, though they are not homogeneous, but that is the case. In the long run, new firms will enter in the market because of the feature, and they start to provide services. In the long run, the extended profit might be raised down, might be eroded completely, or they derive normal profit. Okay, the demand curve will continue to shift leftward and become flatter as long as supernova profit are being earned in the long run. The long run equilibrium is reached when the firm earns no supernormal profit. That is one other interpretation. I am not mentioning much. Healthcare market typically exhibits monopolistic competition, with providers offering services that are valuable but not perfect substitutes. This intermediate scenario allows for some pricing discretion and differentiation among a substantial number of providers. One case study is presented for the maternity care in India. In this study conducted by Meenakshi Gautam and other authors in 2019, the focus was on understanding the competitive landscape faced by the private delivery providers in UP, Uttar Pradesh, India. The research involved a survey of 3,800 private health facilities across 5 districts in the state, revealing that the majority of the payments were made out of pocket, indicating minimal insurance coverage. Okay. Private health facilities encountered robust competition from both public sector entities and other private providers. To navigate this competition, these facilities adopted a variety of pricing structure and non-pricing strategies. Non-price competition was characterized by factors such as their location, medical infrastructure, amenities, staff qualification, reputation, and marketing efforts as well. The study shed light on a dynamically expanding and diverse market marked by variations in the complexity of care provided and the socioeconomic status of the clientele. The market exhibited traits reminiscent of monopolistic competition, highlighting a presence of differentiated offerings as part of monopolistic structure and among the private hospitals in particular in Uttar Pradesh. Okay, we have also cited the paper here for your reading. Then last one to explain in this case is oligopoly market. There are few sellers. One of the specialized form of oligopoly market is called duopoly, where we used to discuss two players case to define their strategies through game theory. We used to discuss game theory here, especially when the decisions are not in sync or no equilibrium decisions are taken, and game theoretic format derives the best decisions. Okay, so hence game theory game structures are suggested, and this is because of the case that either there are two type of pure monopoly and differentiated oligopoly, and pure oligopoly and differentiated oligopoly based on the type of product they are selling, and entry into market is highly restricted. Okay, not 100% restricted, it is highly restricted, and since because of very few are operating, examples are like hospital services, private health insurance, etc. There are multiple models of oligopoly, and we therefore give you a very brief overview. We already discussed. There are two characteristics will make them either to collude with each other or not to cooperate or collude. So hence we say as collusive oligopoly or non-collusive oligopoly. Daphne 2010 explored competitiveness of US private health insurance industry from the period 1998 to 2005, examining if insurer impose higher premium on more profitable firms. It was posited that such price discrimination is viable only in imperfectly competitive markets. Analyzing premiums for diverse group health insurance plans based on employer, location, insurance firm, plan type, year, Daphne found evidence supporting this kind of practice. The findings suggest that healthcare insurance purchase and exert market power in an expanding number of geographic markets, where a 10% point profit increase of firms correlate with an 1.2% rise in health insurance premium. Once it increases, this extend to their profit. Okay. So the exact citation from American Economic Review is presented, and the case study is from USA market. The theory of firm other than profit, what we discuss about profit, other than profit are broadly like defined as if firms do not seek profit, then there are two possibilities. They want to make profit but not to maximize them. They want to they do not want to make any profit but just want to sustain their business, and this is due to different approaches of decision makers. Hence we there are some conflicting version like principal agent problem also comes in between. However, the decisions lies with whether it is through for the ownership, whether for the manager or for the physicians. Ownership wants to maximize profit, managers want to make profit but just to satisfy owners, physician want to want utility maximization of patients, etc. Hence the non-profit maximization strategy are adopted. One of the famous approaches is called growth maximization approach, or the theories are built on this, proposed by Maris 1963. And basically the purpose is to actually go for the target of growth, and growth is highly of course correlated with profit, and growth is also correlated with prestige and job security of the managers. Growth may be achieved either by internal expansion, by the mergers and acquisitions as well. So another aspect is called behavioral theory of firm, starting with some the cases like hospital comprises two separate firms or decisions such as medical staff or administration. Medical staff are responsible for patient care decisions and order services from administrative staff, whereas administrative staff provides ancillary services to medical staff. Hence there are perfect behavioral overlapping. Medical staff is concerned about patient outcomes and their own earnings, while the administration is more concerned with maximizing profit, utilization of services and avoiding space capacity. Hence what is mentioned by Sayre and March in 1963, developed generalized behavioral theory of firm, mentioned the firm is complex organization, comprises managers, owners, workers and customers. Each have their own demands, which we have explained. Some were aspirations and wishes rather than strict maximization is the target. Coming to utility maximization theory, especially hospital based utility maximization theory, Newhouse indeed developed a model of utility maximization applied to hospital sector. Hospitals aim to maximize both quantity and quality of services provided subject to a financial constant. Quality and quantity together comprise the output of the hospital. So hence quantity of services is taken for the explanation as Q, measured sometimes as a number of patients treated or number of patient days of care provided. Quality is measured maybe through the dimension called expertise of clinical staff, status and prestige, quality of care, especially routinely collected statistics such as readmission rates, non-healthcare characteristics such as other provisions, food and ambulance, etc. If we just use these in the utility maximization function, the average cost is assumed to be a function of quality of services, hence AC equal to G of function of K. Demand for hospital services is hence a function of quality of care provided, hence it is D equal to the average revenue is equal to H time K, that is demand and the average quality, the cost we have just discussed. Utility of the hospitals, hence it will be a function of K, the quality and quantity aspects given the constraints, financial constant, the hospital. So hence finally the equality AR of K times AC of K will define the directions for the best use. Maximizing net income per physician, another one. So in that case the per physician the return is also important rather than just the profit maximization. Pauli and Reddish 1970 developed a model of hospital as a physician's cooperative. Patient control how the hospital operates and act as a net income maximizing agent who seek to maximize the sum of incomes of all staff physicians. If TP is total profit earned by hospital and physician staff size is M, then of course it will TP divided by M. Average profit is nothing but the TR minus TC divided by M. Hence, two concepts to be discussed very clearly. Another aspect rather than competition is called contestability. It is not just competition at a particular point in time matters, rather what happens to your potential competitors. You used to be discussed in the context of sustainability. Contestability mentioned by Baumol et al. In 1982 work, they mentioned that what is important in determining the degree of competitive pressure is how contestable the market is, not just how many contestants at that point or there are. Hence, we are actually emphasizing the potential competitors. So, determinants of this contestability is basically the cost of entry and exit into market. Perfect contestability will be think about the zero cost of entry and exit. If there are no barriers of sunk cost, perfect contestability allow hit and run competition. The theory of contestable market says that what is crucial to the conduct of firms is not the actual degree of competition they face in the market, but the threat of competition is rather more important. Contestability explains why the number of competitors may not determine market structure, but does not in itself explain what does determine it. This brings the concept of efficient market structure. Usually in perfectly competitive market, for the efficient market structure, under contestability, monopoly provider is forced to adopt the same pricing and output strategy as it would if faced with a very large number of competitors. Policy analysis should be actually devoted to assessing efficient market structure rather than the level of concentration only. So, these are all, I think we have given all backup for microeconomic theory along with the healthcare sector to derive important directions. Hence, what we discussed in the entire 5 lectures in this week are role of physicians, hospitals in healthcare provisions to the patients, and how can a healthcare provider induce demand. And we also discuss about the traditional economic theory of production and cost and their profit and non-profit maximization theories in healthcare market in particular. So, that is all. I hope you are geared enough to go for the next unit, and next unit is on equity and health. I think that will be useful for you to follow it off, and these are the standard readings. We have given the best in our understanding. You can also suggest if you find anyone useful. With this, it is time to, I think, close next. Okay. So, thank you.